with these two mineral water bottles, I'm going to explain the concept of systolic heart failure and the diastolic heart failure. Now, what is meant by heart failure? Heart failure basically means that heart is not able to pump enough blood to the peripheral tissues to meet the metabolic demand of the tissues. It's something like this. If you imagine that your apartment or your house, there is a water pump there, like the heart, and the pump is not able to pump enough blood to send water to each level of the apartment. Let's say level 8, 7, 6, 7, all this apartment. That is not done. It's similar to that. Actually, heart failure is similar to that. That means the heart is not able to pump enough blood to reach and perfuse adequately the peripheral tissues of the body. That is, heart is failing to do its job. That's why it is called heart failure. Now, the main pump of the heart is the left ventricle. And from the left ventricular perspective, the heart failure could be divided as systolic heart failure and diastolic heart failure. What is the basic difference in systolic heart failure versus diastolic heart failure? These two terms. Systolic heart failure basically means that left ventricle during the time of systole is not able to contract properly, not able to squeeze properly to eject enough blood to meet the metabolic needs of the body. So it's basically pumping failure. It's a failure of contractile ability of the left ventricle. This is called systolic heart failure. On the other side, diastolic heart failure basically means that heart is not filled in properly during the diastole. If you imagine this is the heart, the left ventricle, what you see that this bottle is not filled in properly. So why it is not filled in properly? But what does normally left ventricle does in the ventricle during the time of diastole? It gets filled in from the left atrium to the left ventricle. The blood comes during the time of diastole. It relaxes, left ventricle relaxes. So at the end of systole, the left ventricle is like this, but it is progressively expanding during the time of diastole, and the blood comes from the left atrium to left ventricle. Now, if there is any problem which is basically causing restriction in expansion of the left ventricle, it could be due to some form of restrictive cardiomyopathy. Let's say amyloid got deposited in the left ventricular wall, or there is some fibrosis in the left ventricular wall. So what would happen? The left ventricle cannot relax. Left ventricle would become rigid and cannot relax properly. So what would happen? The left ventricle would not be filled in properly during the time of diastole. So in that case, what would happen? The left ventricle at the end of diastole is only incompletely filled in, only partially filled in. So in that case, even if that left ventricle squeezes hard, still not enough blood would be ejected out. Compared to that, systolic heart failure is what? Systolic heart failure means that this is not a problem of ventricular filling during diastole. What is happening? During the time of systole, the left ventricle is not able to squeeze or contract effectively. There is a failing of pumping ability of the heart purely. That is contractile ability of the heart. That is the systolic failure. You can also think in this way, that to make it very simple, you think that systolic heart failure, what does heart normally do during systole? Heart contracts. So if there is any problem in contractile ability of the heart, that would be systolic heart failure. Then you ask yourself, what is diastolic heart failure? Diastolic heart failure means heart is failing to do something which heart should normally do, left ventricle normally do in the diastole. What does normally left ventricle does during diastole? It expands, it relaxes. So if there is an impairment in the relaxation or expansion, so that does not get filled in properly, that would be diastolic heart failure. So this is the basic idea between systolic heart failure and diastolic heart failure. Now this idea has now been strengthened with the concept of the ejection fraction. This I will be doing on the next session, that how these concepts are connected with the ejection fraction. Thank you so much.